Good morning. I am Bob Ravenscroft, the Vice President for Advancement. It is the Tuesday, May 12th media briefing here at Bryan Health. You just have John and I today. A couple of, I don't know, maybe it was last week, the week before, people were asking about morale. So John's going to share some pretty recent information on physician engagement and employee engagement, where we just got some results back that might help complete a picture for you. And then we had a couple of advanced questions that we'll address after John's remarks. So quickly, our midnight census has climbed to 391. When we got the information early this morning on testing and results, it was heartening to see that we only had 11 more positives than yesterday, which is clearly awful for those families, but it was nice to see a less dramatic increase. There is a large number of pending tests, however. So let's get right to those. We have now administered 5,861 tests. There are 748 positives out of that, and we have 508 pending. Most of the pendings were 442 are at our drive-through. What's interesting is 63 are at our walk-in clinic at urgent care. Can mean a lot of things. It's either people that don't have a primary care physician, easy to access, whatnot, but that's a little bit higher than we've seen at our urgent care for pending so far. So I'll repeat those numbers since I bungled them a little bit. 5,861 tests have been administered by Bryan at our various locations, and 748 are positive, with 508 pending. So, John, it's all yours.
Thanks, Bob. So to cover some of the numbers, we have 27 positive COVID patients in-house. 13 are from Lancaster County. 14 are from outside of Lancaster. We have 3 pending patients in-house, 8 patients on ventilators, 3 from Lancaster County, 5 from outside, 10 in our intensive care unit, 4 in our progressive care unit, and 13 in our general care unit. You guys asked a question probably a week to 2 weeks ago and said, how's the morale? Okay, we've been in this for a couple of months now. So during this pandemic, we actually did an employee engagement survey. Most people would probably say kind of a weird thing to do, but it's the same time we do it every year. Our results came back. We shared it with our employees, and we're in a database of about 2 million employees in Press Ganey's database, and we ended up at the 94th percentile in engagement. And that tells you what people believe about the organization, about the leadership, about how we take care of people. And it came out loud and clear in this survey that people felt safe. And that was, I think, one of the primary things that we constantly look towards, is we want to make sure that our people are safe to take care of patients. And it came back loud and clear from our staff. So we're saying from a morale perspective, we think we're in really good shape as an organization. This happens to be hospital week as well, so we're doing some celebrations with our staff for hospital week. And then you ask the other side of the equation is, how about the providers? How about the physicians? How about the nurse practitioners, the physician assistants? We do that survey as well. And those results came back, and they were at the 93rd percentile in the database of Press Ganey as well. So I would say a clear message that's been given is that our providers, our physicians in this community, the employees have stepped to the plate. They're proud to take care of people. They feel very honored to service people. And this is what they live for and why they got into this industry in the first place. It is about taking care of individuals. And we're just happy to share those type of results. We're very proud of it. We're proud of not the result, but we're proud of the people. Because they have really just done whatever they needed to do to take care of this community and in the region. So with that, we'll take any questions that people may have via chat. So we continue to add additional testing hours to make sure we're handling the demand. There is a requirement though, so if a physician will be doing an elective procedure on a patient, They were asking, some physicians are, depending on the type of procedure, asking for that person to be tested. We ask that they schedule that 3 days in advance. One, it'll give us the 48-hour turnaround from the outside lab, that then we could have all the paperwork and everything ready for that patient the following day. So part of that requirement might be if someone wants to schedule a case in 2 days, they can't get a person in for a rapid test. We are saving those rapid tests for the more severely ill patients and the inpatients. So it's more of just planning ahead and assuring that you're getting people in a timely manner. They're still not solidified, but we will be going to a site on Friday, but not ready to announce that yet. We'll probably announce that tomorrow. No, we are not. With the elective surgery starting to pick up as well, we're getting people back to work. A lot of the folks we have used in different areas of the hospital, if you recall, our volunteers, we have not asked to come back yet. So folks have been filling in those roles. We do have all of our individuals that come into the facility, be it our patients as well as our employees, our providers. They are being temperature checked. They're being asked the same questions that anybody else would be asked when entering the facility. So when you think about all of the doors and entry points we have in the organization, that is keeping a lot of people at work as well.
The usual suspects here. Gowns are still in limited supply. Hand sanitizer has gone from sufficient to limited, and disinfectant wipes are still critical. So everything else is in a sufficient category. Again, our supply chain folks are doing everything they can to secure the gowns we need.